Eating red meat does not cause type 2 diabetes, and now results from a large meta-analysis back this up. So why are we even talking about red meat causing or contributing to type 2 diabetes? Well, because unfortunately, it's a common misperception within medicine and within nutrition that eating more saturated fat and eating more red meat can lead to type 2 diabetes. But this is the perfect example of how observational studies, which with poor data collection, with healthy user bias, with very low hazards ratios or odds ratios, with so many confounding variables, how that is such weak evidence that to try and take that evidence and draw conclusions is just fraught with error. But then when you look at randomized controlled trials and a meta-analysis of these, which we'll go into, there's no evidence that eating more red meat can worsen insulin resistance, can lead to prediabetes or type 2 diabetes, and in fact, it may actually be the opposite. So the other question, though, is why are we at Metabolic Mind, where we focus on the intersection of metabolic health and mental health, why are we even talking about red meat and type 2 diabetes? Well, because we talk about metabolic therapies like nutritional ketosis and anything that can improve your metabolic health as potentially contributing to improvements in your mental health. So if red meat was contributing to type 2 diabetes and poor metabolic health, we would obviously want to know that and discourage it. But as I'm saying, that is definitely not the case. So now, first and foremost, the keto diet does not have to be red meat heavy. It frequently is, but it doesn't have to be. But based on this study, in terms of your metabolic health, there's certainly no reason why someone would want to avoid red meat if they thought it was causing type 2 diabetes or leading to type 2 diabetes, which it doesn't. So now with that pretty long preamble, sorry for the getting a little windy there, but for that long preamble, let's talk about the study real quick. The study is called Red Meat Consumption and Risk Factors for Type 2 Diabetes, a systematic review and meta-analysis of randomized controlled trials, and it was published in the European Journal of Clinical Nutrition. Now, as with any meta-analysis, what they did was they looked at all the randomized controlled trials that fit certain criteria, and they defined what those criteria were, and then they pulled those randomized controlled trials and pooled the data, basically to say where is there a significant difference and where is there not. And they looked at a number of different things. And so as we march through the conclusions, they're going to get kind of repetitive. So let's walk through this here. And when I say repetitive, I don't mean that in a bad way. I just mean it's the same conclusion. So here we go. Diets containing red meat and insulin sensitivity. So studies that looked at red meat and insulin sensitivity. There was no significant impact of diets containing red meat compared to diets with less or no red meat intake on insulin sensitivity. Going down a little further, from a subgroup analysis, there was an improvement in insulin sensitivity with red meat in individuals with type 2 diabetes compared to those consuming less red meat. So not only did it not increase the risk of insulin resistance, but it actually improved insulin sensitivity in those with type 2 diabetes. And then the next section, diets containing red meat and HOMA-IR, which we've talked about before in our diagnosing insulin resistance video, which is basically just a blood test using fasting glucose and fasting insulin to calculate your degree of insulin resistance. And what they found was there was no significant impact of diets containing red meat compared to diets with less or no red meat on HOMA-IR. So it certainly did not worsen HOMA-IR. Now remember, this is not low-carb diets also, I should say, because you could be saying, well, why aren't they improving, right? Why isn't red meat improving it? These are not low-carb diets. So it's not that red meat is going to improve and by itself insulin sensitivity, but red meat within the context of a low-carb diet. It's the low-carb diet that improves insulin sensitivity, and red meat just is along for the ride. It tastes good, it's got tons of protein and lots of nutrients, and it does not negatively contribute by itself to insulin resistance, if that makes sense. But let's keep going. So now they talked about diets containing red meat and fasting glucose. Oh, and look, there was no significant difference. And then they did the same thing for fasting insulin. So since there was no difference with HOMA-IR, we would expect no difference with fasting insulin, and that was the case. Then interesting, they looked at postprandial glucose and insulin. So not fasting, but this time after you eat, what happens to your glucose and insulin. And they concluded red meat intake resulted in significantly lower postprandial glucose compared to diets with less or no red meat. So again, actual improvement, not worsening. And finally, they looked at hemoglobin A1C, pancreatic beta cell function, or GLP-1. And again, no significant difference. So how do we wrap this up? Well, basically, it's pretty clear from this study to me that red meat by itself does not contribute to insulin resistance, to prediabetes, to type 2 diabetes, to metabolic dysfunction, which would also make me think saturated fat by itself likely doesn't as well. Protein by itself likely doesn't as well, right? Because that's what red meat kind of is. And so we can use this as an example of how that observational data that would suggest an association is just such poor quality data and really shouldn't be used to make clinical decisions. And we can also use this to say, okay, well, what can we do to improve all of these things, right? There was no worsening, but what can we do to improve? Well, we improve metabolic dysfunction by lowering carbohydrates, by going on a low carb or ketogenic diet, by instituting nutritional ketosis. Is that the only way? Absolutely not. Not the only way, but certainly is an effective way. And a way we like to talk about here at Metabolic Mind, that those who are using nutrition and lifestyle to try and benefit serious mental illness or any symptoms of psychiatric illness, that nutritional ketosis might be an option, certainly done in conjunction with their provider, with the nutritionist, with their doctor, done in an organized and controlled and safe environment, but is certainly an option. And there's no reason why that shouldn't contain red meat if you're worried about metabolic function. So hopefully this helps you understand the difference between the observational studies, the randomized controlled trials, helps you understand that red meat does not contribute to insulin resistance and type 2 diabetes. If this was helpful, again, click the thumbs up, click the subscribe, leave us a comment. We want to hear what you think about this, and we'll see you here next time at Metabolic Mind. Now also, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or your medications.